Like everything in life, social media as well has the good side to it and the bad side to it. While it has created multiple millionaires who have just done content on social media and have become superstars, like influencers और ये सारी चीज़ें, ठीक है, content creators who are making millions out of YouTube, Instagram पे content बना बना के लोग जो हैं कान तक पहुंच गए हैं. While that is there is other part of it is over dependence. Psychologically speaking, people just get into the cocoon क्योंकि मुझे सिर्फ 100 लाइक्स आए और मेरी जो क्लासमेट है उसको 200 लाइक्स आए. ओ माई गॉड, आई एम नॉट हाफ एज गुड एज हर. सेल्फ डाउट क्रिएट हो जाता है. नाउ व्हाइल ऑल ऑफ दिस इज हैपनिंग, it is for sure that social media is linked with a decline, or rather challenges your mental health. Good or bad is something that a survey was done, and it said that 60% of young Arabs thought it was having a negative impact on their mental well-being. To talk more in detail about that, we've been joined by a clinical psychologist, Sri Hari. Now, social media is a new thing, a new addition to our lives. Before this chapter came into our lives, clinical psychologists like yourselves were working on so many things already, which were established, which had, result-driven exercises and
Mm-hmm.
a step to achieve what the goal is. But now, with social media coming in, professionals like yourself also find yourselves in challenging situations के अब इसका क्या करे suddenly because YouTube पे उनको likes नहीं आया, Instagram के pictures पे likes नहीं, and they're getting into depression.
Mm-hmm. Yeah, yeah. See, like, everything has two sides. We have negative sides as well as positive sides because we know that, this is inevitable part of our life now. We cannot
True.
think of a, phase where we are not with all these kind of social media because we are getting connected through social media, especially post-COVID, we are more dependent on all these kind of facilities, right?
Hmm.
But too much into that again has a lot of negative consequences. Like rightly you have pointed out, say it's almost similar to a kind of substance addiction where you have a lot of similar kind of symptoms in the social media addiction as well. Because like you involve too much of time into that, and you are all frequently waiting for the likes and dislikes, and it has a lot of things to do with our own self-esteem. Like our self-worth depends on the responses in our social media. So there are recent studies which shows that a lot of narcissistic self like traits being increasing with the use of social media because our face-to-face contact is comparatively reducing, and then it's more of lacking our social cues, social skills, and all that. So it's affecting our emotional and other development as well. But we need to think in terms of how we can develop a kind of a healthy usage pattern.
Mm-hmm. So, what is the healthy usage pattern? Because like for everyone, like we say,
Yeah.
in say food nutrition science, yeah, we say
Hmm.
that protein is important, but not everyone requires the same amount of protein. So, similarly, social media also, not everyone is okay with the same amount of social media exposure.
Right, right. See, again, there is a lot of debate regarding how can we say that it is whether excessive use or not, because
Mm-hmm.
like in terms of whether it's time of use that says it's more excessive, or it's the kind of content that you are using in the social media. So there are a lot of debate which is exactly going on because like if you say in terms of psychological point of view, we have only gaming disorder which is included, internet addiction included as a diagnosis actually.
Okay.
But the other things like there are a lot of new terms coming with this kind of social media, like ring city, tech city, for nomophobia, FOMO, all these kind of terms, right?
Mm-hmm.
So there are a lot of other things, but we are yet to conclude whether it's significantly a kind of a kind of a mental health issue, or is it something which happens but not affecting our daily life? Because as you said, 60 percentage knows that they are being affected.
Mm-hmm.
I mean, like they many of them feel that they are addicted, they are spending more time.
Right.
But the fact is that it's like not affecting their other life areas, right? Because like they engage in other activities, but at the same time they engage in these kind of entertainment, other things which is mostly into the social media. So possibly it is not affecting their life to that extent. That is why they don't feel a negative, more of negative consequences. Even
Mm-hmm.
they subjectively feel that they are getting addicted using it more,
Right.
but the impact it has on the life, like in terms of like if you are using a substance, it has physiological, because you are you have an intake of some substance and it
Mm-hmm.
has some impact on your body. But here it's not like that, but we need to see in terms of how far it is affecting your routine work. Like say for example, if you are taking students,
Mm-hmm.
how far it is affecting their academic work, their sleep, their other normal, like they can develop anxiety or other kind of features from that. So depending on that, we need to see whether it's going to an unhealthy level. So just
Right.
based on the time of use, how much time you are using, we cannot say that is whether it's healthy or not. So
Mm-hmm.
to say that it's some problematic use, it has to affect your regular functioning, like in terms of your whether if you are working, your job, or your health
Mm-hmm.
in terms of your mental health as well as your physical health. So some sort of impact this usage has, then we need to seriously think how we need to handle that.
Right. But Srihari, for everyone, like we say that while there are problems and challenges, there one can always look at the solutions to it as well. So
Yeah.
for say someone who is a teenager or a school kid versus someone who is a professional, a working professional who's working in the world in the world of social media, you know,
Mm-hmm.
for a school kid, a teenager, the
Mm-hmm.
mental well-being based on how many likes you've got versus how many likes or comments your friends have got, there could be a self detrimental effect based on the judgments of the people around you. While that
Yes.
is there, and it does affect
Mm-hmm.
mental well-being, and we've seen that in so many young kids. For
Mm-hmm.
professionals working in social media, this also comes into that, hey, your KRAs are not half as good as someone else, because you are
Yes.
not
Yes.
be able to pull out that kind of results on the content that you are creating, while they're probably creating it
Mm-hmm.
for the organization. It still
Mm-hmm.
comes under the umbrella of social media.
Yes, yes. See, there are two aspects to this. Like, the first one is when you're handling the children, like, adolescents, like you're saying in terms of likes and dislikes, they tend to equate that with their own self-esteem because, like earlier, our self-esteem was dependent more on social interactions, like in social situation, how it was. And then now it's fully turned on to the social media where, we tend to evaluate yourself based on your likes and dislike, how others are appreciating you through the media,
Mm-hmm.
right? And even for that, if you are talking about the adolescent part, you need to think of educating them from very beginning, because like if you see the onset of the use of smartphones, actually, all this media, like those who own actually this smartphones, that age is again, I think, around 12 to, it ranges from 12 to 15, the first use actually.
Mm-hmm.
So possibly, I think, the parents and there was one study actually, one by one Alexandra Samuel. She's a tech speaker, researcher, and data journalist. So she identified three types of digital parents actually. One is
Uh-huh.
limiters. The limiters, the limiters. What they do is, like, they take every opportunity to restrict the use of screens actually.
Right.
The limiter parents actually, and you have enablers, who give it to their kids for their expertise actually. They are the experts actually. The kids are
Mm-hmm.
the expert. The parents, they don't know. So they are the enablers. And the third kind of parenting is the digital parents actually. Sorry, mentors actually. Mentors, they actually guide them actually how to use it. So it's like, helping them,
Mm-hmm.
and how to use, and what to use, what not to use. So studies, what shows is, like, the children of limiters are most likely to engage in problematic behaviors, or
Okay.
like those kind of stuff. So it's good that you start from the very beginning, you let them use that,
Mm-hmm.
but use it in a healthy manner. That, I think, even in schools or with parents, actually, we need to do that. And on the professional side, it's a different thing. Like, you're talking about getting the likes, and
Yeah.
engaging yourself to expand your business and all those things, like. And I think that you need to take that in a professional sense. It's like,
Okay. Then in that case,
because,
that should not be taken under the umbrella of social media, because that kind of challenge would come at any work, any
right,
organization,
right.
any
It,
scale.
it, it would come under any work, right? I mean,
True.
it's not like, it has to be considered as a part of a job. Like, It's like keeping apart this social media. If you are if you want to meet the target, actually you need to do that, right?
Which is true. I mean,
So
it's almost like
that's a,
getting a sales
some sort
target.
similar to that. Yeah, yeah, yes, yes.
Absolutely. But Shreyari, thank you so much
Right.
for having this conversation with us.
Yeah.
And,
Thank
and,
you.
and especially when you spoke about the research and the type of parenting that could
Yeah.
change the mindset of the kids using social media is incredible. And I'm
Right.
so glad that you put this out. Could you just
Yeah.
again restate these three types of parenting so that, we re-emphasize to the listeners who are with us right now?
See, there are three types. One is limiters. Limiters are type of parents who completely stop, children from using the screens. Actually, every opportunity they find, they will try to restrict them. Okay.
Mm-hmm.
Enablers is like parents who give everything to their children. Like, they are not very skilled and they don't engage in anything, and it's a kind of free, racist free kind of a thing. Like, you allow everything for the child to do it. Okay. And mentor is a parent who actually guides the kids into the social media, and make them aware what to do, what not to do, what is healthy. So the mentor kind of digital parenting is a good one to follow. And if you are a limiter, especially in the in this era, actually it's very difficult to remain completely abstain from this digital world and all that. So
Right.
completely restricting or abstaining from that thing is a very difficult task. So if you are a kind of a parent who is a limiter, restricting the child, then the possibility is that in the future they can run into all kind of problematic behaviors.
Thank you
So be
so
a
much.
mentor.
Be a mentor.
Yeah.
That's what it is. Thank you so much, Srihari, for this
Yeah.
conversation. It's always good to know that there is like every coin which has two sides. Even social media has two parts to it. How you ride the wave, that is more important. And Srihari, a clinical psychologist, joining us and helping us through the thinking process. Thank you so much, Srihari, once again.
Thank you.